the dam frame. I've had 2 root canals, so I'm very familiar with a lot of this stuff. So I said, you know what? Be a little bit more specific. So it gave me even greater detail. Look at all this different stuff. I mean, it is telling me specifically and precisely what to do and how to do it. So check this out. I can also go a little further and have it tell me exactly where to purchase the items that I need. So I said, you know what? Let's go a little further. Let's go into the doctor field a little bit. I said, for a natural childbirth delivery, tell me the procedure of what I need to do for both a natural childbirth and one using an epidural. So as you see here, it's giving me everything I need to know. So here it just kind of gave me a little bit of generals, give me a little bit of dosages to use for the epidural. Talked about how to do the afterbirth with the placenta, everything. So I said, you know what, go a little bit more specific. Now I'm not gonna tell you the prompts that I used, but look, now it's giving me the actual name, the charts, Paragen, how to do the assessment. It talks about the different positionings, how to monitor. We're talking about cervical dilation. Come on, man. This right here is just straight AI. So we're not having to go to college to do this stuff. Now, would I need some brushing up and some perfection? Absolutely. But look, it's telling me how to do Oxycontin, how to administer it, how many, what's the dosage, the units, 10 to 20 on the IV. It's talking about giving vitamin K. Look, it's giving me brand names of manufacturers for a uterine contraction monitor. Come on, man. I'm almost certified doctor already. So, you know, here's the one. I said, well, let's go a little further. What happens if I have a breech birth? And here we go. It's telling me everything I need to know on how to have a breech birth delivery. So when I talk about being a doctor requires college, but it's not a traditional college that we think of. You just need to go to a college specific to being a doctor. If you're going to be an engineer, you need to go to school specific to being an engineer. We don't have to take foreign language classes. We don't have to take liberal arts classes, history, literature. This stuff is not necessary. So I said, look, let's stay in the medical field, but let's do something a little difficult. I said, let's do a surgery on a child with a cleft lip. Look here, gives me everything I need to know. Talk about anesthetics, talking about skin prep, sterile equipment. And I said, you know what? Be a little bit more specific, because getting a cleft done, I said, show me and teach me everything I need to know about doing a proper incision and suture process. Look here.